something on Instagram live, some rare remedies. Now, whatever I've told you, the symptoms of rare remedies like Viscum or Viburnum opulus or Vinca minor or uh, Viola tricolor, those are the symptoms that I have seen in my practice. If you open the Matermedica, you have some more symptoms also of those rare remedies, but those symptoms which I have discussed you with Instagram live is the symptoms which I have seen in my practice and which I have confirmed in my practice, and I have been giving those remedies mainly for those complaints apart from the mental symptoms of that remedy. So a lot of people were asking something more about that remedy, something more about some rare remedies. Symptomatically, if you go to see, there will be a lot of information in the basics book of Mathematics. You can go through and enjoy that symptoms, but I only deal with the clinical approach and the clinical symptoms which I have seen in my practice. Then only I can tell you about those remedies. Okay, so those symptoms basically are clinical symptoms which I have confirmed and reconfirmed in my practice. Dr. Bharat, Dr. Moria, good afternoon. Now today, if there are no questions, please ask me questions, because that is more interesting rather than discussing Mater Medica. Because once you ask something about Mater Medica, then the whole half an hour goes about discussing about Mater Medica. Now, one symptom which we commonly encounter in a practice, especially when doing pediatric practice, there are some mothers who come and tell you, sir, my child is like this only. When he wakes up, he starts. I have this, I have this, I have this, I want this, I want this. He just starts and does not stop. And then the poor child says, no, I don't do this because I am angry, because, I have not eaten in the night because this, and then he gives reasons. But the mother is like that only. Sir, when he gets up, when he wakes, and he starts, he is demanding, he wants this, he wants that, he has pain in the abdomen, he has pain in this, he wants something to eat, and he starts and he starts and he starts. मतलब हिंदी में कहावत है ना, डॉक्टर साहब भी उठते ही शुरू हो जाता है. What is it? डॉक्टर साहब भी उठते ही शुरू हो जाता है. Now these are the very common, symptoms, very common, what you call, I will not say symptom, but these are the very common, what you call, one-liners which the patient comes and tell you. And if your Mathemedica is good, if your interpretation is good, you can convert those one-liner into rubric form or symptom form. Simple, this is called as complaining on waking. Simple language is complaining on waking. You can tell me the remedies which are there, then I'll tell you the most indicated remedy which I normally prescribe in my practice. Before that, I can take a question. Sir, your experience about stammering case, similar dose and repetition and result. Yeah. So stammering. If you open Mathemedica and the first remedy, which we were taught in our college days, we can't say school days, was stramonium. Now, whenever you find speech stammering, there are some drugs which are very, very importantly indicated, like stramonium, like we have Nux, we have Merxol, we have Causticum. Now the results, speaking about results, I definitely have good results while I am treating case of stammering. I would not say 100% results. I also have failures, but fairly good results in practice. The only important thing to note is that there are different types of stammering and different ways of stammering. Previously, what used to happen in early days of practice, because we were taught stramonium, in most of the cases we used to give stramonium. But a stramonium has a very, very typical type of stammering. He will stammer like this. Sir, I have a problem. So this is a stammering of stramonium. Means, he has to exert a lot before he speaks, and there is a distortion of face. That is the stramonium stammering. Did you get it, Dr. Moria? This is the stramonium stammering. Now, there are other type of stammering, like for example, the patient comes to, sir, I have come in your clinic. Sir, I have come, and then he starts stammering. So, the patient can speak the starting properly and he stammers in the last word. Then the remedy is lycopodium. Or the patient says, "Sir, I have got a problem like this." So he's stammering in the first word. Then the remedy is spigelia. Uh, and there are some patients who basically every word they stammer. "Sir, I came to," every word they start stammering, and the stammering is very loud. Then the remedy becomes hyoscyamus. So if you open Mater Medica, there are a lot of remedies. This is the remedies which I can, which normally I see in day-to-day practice. Stammering, distortion of face before stammering, stammers in the last word, stammers in the first word, and stammers in every word. This is very common I have seen in practice, so I remember that very, very clearly in my mind. I hope you understood, Dr. Maurya. Yeah? Yes? So this is something about stammering. So whenever you get a case of stammering, apart from that, you can also think, why did the patient start stammering? A lot of patients comes to us and they say, he was very okay, but last since 1 or 2 years he started stammering. And then you have cause elements from maybe somebody's death, maybe a problem in career, maybe a problem in finance, maybe a problem with a fight, maybe a problem with the quarrel. So if that is the cause, then absolutely your drug picture changes. But the local symptom is also important, because sometimes the local symptoms also give rise to basically the mental symptoms of the patient. So in this case, you basically have to take why and how did the stammering start. If you can get the cause, then automatically your remedy comes to you. I hope this answer is sufficient, Dr. Maurya. Or you want me to elaborate on this? I can elaborate more. But now, what question I asked you? Complaining on waking. The patient comes and tells her when he gets up and he starts. He gets up and he starts. The remedy you must think about is a simple remedy, Sina. Sina has a very, very important symptom, complaining on waking. ये उठ के शुरू होता है. These are the one-liners of the patient that you have to make sure and write in your book, so that in future, if this you read in your Mater Medica or your practice, you will get the answer. Okay, complaining on waking. Similarly, of course, carrot desires to be, and carrot desires to be fast, and carrot desires to be slow. You can think in Sina, but I will tell you one more symptom which is very, very common in Sina. A Sina patient, remember, good afternoon, doctor. A Sina patient, a Sina child, if you want to prescribe Sina, this is the entry point which I look. Sometimes, carrot desires to be is basically little caring, or carrot desires to be all the implied rubric that he wants somebody to take care of himself or herself. Very difficult, to understand that. So, carrot desires to be, you can take that. One symptom of Sina that you must think is refuses help. The child of Sina or the patient of Sina does not want to be helped. Please write down, refuses help. उसको मदद लेना पसंद नहीं है, वो सभी खुद ही करना चाहता है. That's why if you take the rubric carrot desires to be, that means what? Either little caring, or he wants this part of work somebody else should do it, carried. But this symptom of Sina, which I have seen lots in my practice, is refuses help. Please, see, extremely irritable. Whether it's extremely irritable or mildly irritable or too much irritable, that depends upon your interpretation. So you can make a mistake in that. But these symptoms basically are so interesting, refuses help, then you can prescribe Sina. Let us go. While yawning, breath obstruction, are there any medicine? Yeah. Gagging and vomiting. You have some remedies where there is a spasm of the epiglottis. So go to the repertory and see whether there is a spasm of epiglottis, and you can get the remedy in that also. Okay. Did you understand what I want to tell you? See, there is everything in homeopathy. For example, if you see inflammation of epiglottis, dryness of the big glottis like lacuses. We have a very rare drug called as Vithia, or the thing which you ask is paralysis of epiglottis. Then you can think of Senega, Econite. These are the remedies which I can remember. Good afternoon, sir. If there is a lot of heat in the stomach, the digestive system is weak. There are issues, especially if there is burning sensation in the sinus due to acidity. Then what would be appropriate to give? Okay, very interesting symptom. Because of the heat in the stomach, he has sinus problem. Very much surprising. I have never seen this type of cases in my practice. But this symptom, lot of patients does not tell you that the patient is feeling that the gas is going in the head. The patient that the gas is going in my eyes. Explain the patient there is a diaphragm, and the diaphragm is totally sealed. It does not have any holes, so the gas cannot go from the holes and go to the head. So it is a layman's term. Okay, yeah, I'll just come to that. Sina child, I'll just answer the question first. So very difficult. If there is bloating in the abdomen, the diaphragm can be shifted up, it presses the lungs, and you can have eructations. But this you can go and see called as associated symptoms. Okay, associated effects. You can have pulsatilla, you can have Naxomica, you can have Veratrum. I think there is sulfur also. In that you can get the answer to this. So one of the questions, Sina, the traits of Sina. First of all, tell me that did you understand that the refuses help is Sina? Very important. These are the clinical symptoms which I have seen in irritability, anxiety, anticipation. That depends upon your perception and the patient's perception. The patient says, I'm anxious. Then you have to decide how much anxious and whether that is normal, abnormal. So you can make mistakes in those things. But whatever symptoms, the patient comes and tells you, which are very, clear, refuses help. The clear symptoms, Sina. Chamomile also refuses help. I have not seen. Okay, Sina. Now, Sina, one symptom also of Sina is very important. Weeping. Weeping symptom is also, can anybody tell me is weeping? Weeping in children's. Pitifully when awake. But he gets up and he starts either demanding or starts crying. But pitifully. Weeping children's pitifully when awake. The remedy is Sina. One more symptom of weeping is weeping piteous when carried. Now this is a symptom more important than carried desires to be. Are you with me? So weeping piteous when carried and weeping pitiful when awake. That's why there is a very interesting symptom in Sina. Quieted cannot be. Even petting and caressing are no use. Matlab, he cries so much. You give a good talk, you explain him, you pamper him, you give him something. The patient is crying. So quieted cannot be. Now this is again a very important symptom of Sina. So quieted, refuses help, and weeping becomes the core symptoms of Sina. This is of course what I have seen and what I prescribe in my practice. You can take other symptoms also. For one doctor is telling me something about Sina also, but whatever I have seen. Otherwise, this symptom of mind, irritability and anxiety and anguish that you have to interpret becomes sometimes difficult. Yes or no? Anyone? Anyone? Yes or no? Are you understanding? If you answer, then I also know, no, I have not seen a Sina child refuses help. There is no symptom I have seen in my practice. Carpal tunnel syndrome, only numbness, irritation on tip of the fingers. Now see, if you open your Mater Medica and you see irritation, pain, numbness in tip of the finger, there are a lot of remedies. But now, if you have only decided that the numbness is because of carpal tunnel syndrome, then you will not be able to prescribe, because in homeopathy, what we say, it is not important that which disease the patient is suffering from. It is important what symptom the disease has thrown, and then we try to prescribe on that symptom. Now, this is a very, very important symptom of few remedies. You must remember this remedy, whether it is carpal tunnel syndrome, whether it is cervical spondylitis, whether it is ankylosing spondylitis, but this numbness in the tip of the fingers is a very, very important symptom. Thank you for asking the question, because these are the remedies which are very, very clear in my mind. Always think about phosphorus. Always think about causticum. Think about Staphylococcus aureus, lachesis, epismel, whatever remedies I can remember now. Now, if you open the repertory, if I am not wrong, there are some symptoms in relation to particular finger. Numbness in the first finger, numbness in the second finger, numbness in the third finger, numbness in the fourth finger, and numbness in the little finger, tip of the fingers. If it is very, very prominent, I had a mistake when the patient said, Doctor, I feel numbness here, and you prescribe the remedy. Next time he comes, no, numbness here was more, but it happens in any finger. Then the prescription is wrong. So it is very important to take a generalized symptom first, numbness in the tip of the fingers. Just to add one more thing, there are sometimes numbness in the tip of the toes. Then also the remedy is phosphorus. Just add one more remedy which I remember is tobacco. Are you with me? Do you understand, Dr. Devangi? Okay, did you understand that? Anyone? So yeah, something about did you understand something about Sina? At least tell you have understood, so I can proceed forward. Otherwise, Sina has common symptoms. What you have seen, carrot disease too. I don't look at that. I don't look at that because it becomes sometimes. Do you find difficulty in interpreting mind symptom? Anyone? Do you find difficulty I interpret something else, and my doctors who are working with interpret something else, and every time the doctors who are working with me, they feel, oh my God, sir, we can't interpret what house or interprets. It is not like that, So I always tell them, interpret which is very easy, maybe on the physical level, because I have experience of 30 years, and the doctors who are working with me are just interns or doctors. So there's a difference of interpretation. So I always tell them, basically interpret what is the physical symptom first, that is easily interpretable. Otherwise, you can interpret delusions in different forms. We have different forms of interpreting. Somebody interprets directly, and then somebody interprets implied. So it becomes different. Vomiting would be vomiting basically, or vomiting would be taking out all the emotions. Very difficult, If you get results, well and fine. If you don't get results, then they are confused. So first of all, interpret what is physical. That's what I'm telling you. In Sina, refuses help, very easy to see. In Sina, weeping, piteous, on waking, very easy to see. In Sina, weeping, quiet and cannot be even pitying and caressing, very easy to see. So you can prescribe Sina. Now you're taking carrot disease to be, maybe your mother or grandmother would be telling you, my every child, whenever I put them on my lap, they are very happy. So whether to take that symptom for prescription or it is normal, then we have to decide. So whatever we have to decide in early practice becomes difficult. Are you with me? Anyone? So I am telling you the basic is Sina. No, Sina is not a spoiled child. Sina is not a spoiled child. Bichara bachpan se, he's like a wormy child, you can say. Okay. Now, just comparing something related to chamomilla. Now, like whatever I have told you something about Sina, I'll just compare about chamomilla. Now, if Sina has piteous crying, chamomilla has howling crying. Now, what is the difference in Sina? Piteous crying. Chamomilla, howling. The difference is the intensity. Piteous crying, this crying becomes Sina, and howling becomes chamomilla. Did you understand? The second difference would be weeping with sleepiness. This is a very, very important symptom again of chamomilla, not of Sina. Weeping with sleepiness, write down, a very, very important differentiating feature of chamomilla. Third symptom, weeping in children's. when he wants something and you refuse. Things wanted are refused. You want the remote and you don't give the chamomilla patient remote, he starts weeping. So did you understand the weeping of Senna and chamomilla? This is the difference you have to know. Now this you have to understand and read Mater Medica every day. A chamomilla is more violent than Senna. In a single difference is chamomilla is more violent than Senna. How is the violence? In anger, a chamomilla patient will throw the toys. In anger, the chamomilla patient will throw the toys. Are you with me? Are you understanding the basic difference, the practical difference of chamomilla and Senna? Okay. Now I told you a Senna child will be weeping cannot be quietened if he is on the lap also, but exactly opposite is chamomilla. Tranquility when carrying on the arm. Did you understand the basic difference, the black and white difference of chamomilla and Senna? This is how I prescribe in my practice. Okay. Sometimes, I had a very interesting case where the mother used to come and tell me, sir, he wakes my child wakes up in the night and just talks rubbish, talks strange thing. Mummy, I am going to the moon. Are you coming with me? Mummy, today my teacher will come home to teach me. I'm not going to the school. I had a parent telling something about that child, and I was surprised what to give. I gave some, it did not work. Then when I was reading Mater Medica, reading again, I'm telling you, I also read. There was one symptom in chamomilla: talk strange things at night when awake. Are you with me? Talk strange things at night when awake. The only remedy is chamomilla. I had missed out prescribing for 2 months, I think. Then I prescribed chamomilla 30 and the child was better. So there's a question of potency. Sir, potency selection. See, there are different authors having different views about the potency. Normally, I start with the 30 potency and then go gradually to 200 potency and then maybe to 1M potency. That's how I start the potency. And first of all, it's also important that whoever doctors are working with me, you can contact them also and ask about my practice and how do I prescribe, so that the transparency has to be maintained. This is very, very important, my dear friends. Otherwise, talking something on the webinar or a lecture and practicing becomes very, very difficult. There's a wide difference. So I always tell the students who are working with me, you can ask them also how is my practice. It is nothing hidden as such. But the difference of Mater Medica reading and clinically observing is a very, very important thing. You can know your Mater Medica by heart, line to line, any Mater Medica, but application then becomes difficult. The child is crying in front of you and you think, oh my God, this is what crying. Then you have to know at least crying remedies 3 or 4 that you can differentiate those remedies. So my advice to all the doctors would be, the philosophical approach is very good. You are well appreciated in this conferences, seminars, but when you are in the clinic, sometimes it becomes difficult to interpret. So whatever the patient is telling in front of you, behaving in front of you, whatever the associates are telling to you, try to make a note on the paper. At that time, you might not be able to get the remedy, but when you make a note, every time go home and refresh, and then you will understand the remedies better rather than, reading every day and just mugging up the symptoms. Are you with me, everyone? Yes? By combination 28, proline B12 deficiency and malabsorption. Yeah, sorry, I have never prescribed in those pattern, my dear friend. So I will not be able to tell you. By giving biochemic 28 whether B12 will improve, I will not be able to answer the question. Okay? See, there are so many remedies in homeopathy. We have got direct remedies also now. Hemoglobin, vitamin C, vitamin B, B12, vitamin D3. I don't know how they work and all, but I don't prescribe 28 number. Sir, blood comes out from the stools only when patient passes. Constipation stools blood color is either maroon or bright red. There is no pain, no burning symptom. Will whether retania help? No, if your case basically is of blood in the stools, retania's first symptom is burning. The burning is so much it stays with the patient 2 hours after passing stools also. So the first three marking symptom, the first peculiar symptom would be burning. So blood in the stools, simple my dear friend. If you don't get the remedy, simple hemimylase is there, millefolium is there, phosphorus is there, erigeron is there. Give the basic remedies. I think that should help. Don't give retania if burning is not okay. I hope that answers your question. I have a lot of remedies for burning, but I don't want to confuse. These are the basic remedies. Please try out these remedies and you will get the results. Okay. So how to prescribe biochemic in 3x or 6x potency? Yeah, whenever I prescribe biochemic, I basically start with the 6x potency also. Just one thing I would tell you, there's a very interesting remedy, Kali Moor. I used to prescribe whenever there was a ear problem and the coryza was in the ear, deafness in the ear, discharge from the ear. Kali Moor 6x would work wonderfully. This is the only I have a very sporadic knowledge about biochemic because I hardly use them. Previously in my practice, I used to use ferrum phosphor for fever, but it did not help in every case. But Kali Moor, remember, I 6x remember for ear problem, deafness in the ear, discharge from the ear, coryza, it works wonderfully. But I don't prescribe so much biochemic medicine, so I'll not be able to give you a definite answer. Okay, so I think this is understood. So did you understand the difference of chamomilla? This is, I would say chamomilla is a very irritable patient and Sina is a less irritable patient. Now, how will you judge what is more and less? Okay, very difficult. I would say, chamomilla is very snappish and Sina is not snappish. Now, how do you ascertain the snappishness? Some child would have anger tantrums, some child would have anger. So how you differentiate an anger tantrums and snappish? Difficult. So you'll be able to miss out the remedies. So that's why I did not tell you these type of differences: irritability, the anxiety, the vindictiveness. It depends upon doctor's judgment. So I told you only difference where you can actually differentiate chamomilla and senna, because since the college days we have been getting short notes, the long answers, people telling what differentiate chamomilla and senna, and the first answer would be worms senna and very snappish chamomilla, very angry chamomilla. But how do you ascertain that? That is important. So my differentiation is always black and white. This is senna, this is chamomilla. So this is how I differentiate. Okay. Now weaning, yeah, it is there. But how do you define weaning and how do you understand that the child is weaning? What will you take for weaning? That is also important. You can get the question, the meaning of weaning from the internet. But sometimes become difficult for a normal homeopath to understand what is weaning. To complain about something. Crying voice. Now, crying voice would be irritability, would be pain, would be a lot of things. To make an unpleasant, when we used to teach weaning in chamomile in my college, I used to tell to make a loud, high, unpleasant sound because of pain or whining, because of pain or unhappiness. Now, very difficult to understand whining. Okay, but it is there in Sina. You can prescribe if you get it. Piteously, yeah, piteously, then it becomes Sina. Okay, so again, whining and piteous will become difficult to differentiate also. Sir, how to remember all symptoms? Sometimes it is very confusing. No, Dr. Sharma, it is not confusing sometimes. It is confusing every time. For me also. That's why I have made pictures of some remedies, clinical, what I have seen in my practice. And I tell my doctors who are working with me, please try to make picture. Because this is a picture I have made from my experience and then I prescribing. Maybe someday else you will have your own picture of remedies. So learn from me and try to make your own picture so that the homeopathy grows, not the doctor. Doctor is growing, the pathy has to grow. So every time the younger generation is definitely better than the previous one. So you have to make a picture that this is the picture of the remedy which I have seen in my practice and I apply that first. If you apply, you get result, that picture becomes more clear to you. That's how I learned my Mathemedica. That's how I learned my differentiating Mathemedica. Okay, so I think it's already half an hour up, and thank you for joining me, and thank you for asking such beautiful questions, which I also get revision of remedies. And I thank you. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. For next Thursday. Goodbye.